So you can kind of see the evolution of healthcare reform. A lot of the candy or the gravy or whatnot that most people can agree with, not canceling people for health conditions, or people like the idea of keeping their 26-year-old on their policy, things like that. But then more recently, we got to start paying for it with some medical device taxes, taxes on pharmaceutical companies, taxes on high-income earners. So we're starting to see some of the, as Paul Harvey would say, the rest of the story here over the last couple years, but nothing that Tina just went over really compares to what we're calling, certainly not to make it analogous to a war at all, but a line in the sand is January 1st, 2014, D-Day for healthcare reform, when things are going to change forevermore from this date forward, and significant things take effect on January 1st that we're going to go through right now, because these are the things that are impacting our plan and our capacity to keep offering it in the way that we have in the past. So again, this first slide here are things that most people can kind of wrap their arms around and agree with. They're going to have guaranteed issue, so no one can be declined for a pre-existing health condition. Guarantee renewability, as long as you pay your premiums, you won't be canceled. There's essential benefits, so every health plan, again, this is all in the under 50 employee market, every health plan has to offer essential benefits. We're going to go over them. So the government has said these benefits have to be in every plan. If you're offering insurance to your employees, you can no longer have a waiting period longer than 90 days. So that's going to take effect January 1st. So some people say you got to wait 6 months, for instance, to be eligible for your health insurance. Now, 90 days. This is regardless of how big of an employer you are, whether you employ 2 people or 2,000 people. If you offer health insurance, then 90 days is the longest period of time that you can have someone wait. And then we have no pre-existing condition exclusion. So that guaranteed issue, no pre-existing exclusion, it has a feel-good component to it, because certainly there's those folks that just couldn't get insurance that really needed it in certain situations. But it also has some potential for abuse, and we'll talk about that a little bit when we look at the individual mandate here. The guaranteed issue prohibition of existing conditions in conjunction with the individual mandate and the very small fines lead to the potential what we call adverse selection in that risk pool. We'll talk about that a little bit more when we get to that. These are the 2 things that get very, very little press. You don't read about them. Has anybody heard of community rating of health insurance plans or aggregating of plans? Anybody? That was what Tina just alluded to. So we got one person. Okay, this is one of the key components that makes our MDA plan or any of the plans in the under 50 market not able to continue forward in their current status. And the second one is this actuarial scoring or metal tiers that Tina alluded to, and we will get into more detail on both of those as well. But those are the things that get very little press. You're not reading about them or seeing them on the evening news, but are really, really disrupting the insurance market. Probably the 5 things that you do hear about the most that are also really big are these items on the board right now. So the first one is the individual mandate. So that's actually what went to the Supreme Court. The people who took it to the court said the government can't force me to buy anything, let alone health insurance. And the Supreme Court ruling is actually a little bit misunderstood by many people. I think people think that the Supreme Court ruled, well, the government can make you buy health insurance. And actually what they ruled is that they didn't rule that they can make you buy it. They ruled that they can tax you if you don't. Okay? So they can't make you buy it, but they can tax you if you don't. So that's what the Supreme Court ruling actually came down to, and we'll get into what the taxes and the fees are for not having insurance here in a second. Now, the real goal of health care reform, even though it's called the Affordable Care Act, ACA, it's really more about access to care, okay? So they could have still called it the ACA, and it would have been probably more appropriately named the Access to Care Act. And the main goals, Tina threw it up there, was 30 million people who don't have insurance in the United States, and the goal was to get them insurance. how they're accomplishing that. Why do they not have insurance? A lot of them say, well, I don't have insurance because I don't have any money to buy insurance. So they're going to be giving people up to 400% of the poverty level subsidies, and we'll get into that in more detail here in a second. They can use those subsidies if people are eligible for subsidies. They're only eligible to use them on the government's exchange is the word they first came out with. They more recently changed the name to Marketplace, but that's their website that probably everyone has heard is crashing and burning right now, and no one's getting signed up on. We'll get into that a little bit, but that was supposed to be their marketplace, or where people were going to go buy their insurance who were eligible for subsidies. We had the pay or play mandate. So that doesn't impact a lot of dental offices, but it does impact some. That's the mandate that if you employ 50 or more employees, then you must provide coverage to them, or you get to pay a tax or a penalty or a fine. It's the reverse of the individual mandate. It's the employer mandate. And again, they've been ruled taxes, not mandates to purchase. So they're taxes for not versus mandates to do. And then the Medicaid expansion. That got a lot of press here recently because in Michigan it was teetering on whether we were going to expand Medicaid or not expand Medicaid. So right now Medicaid is up to about 100% of the poverty level. That's about an income of about $10,000 or $11,000 a year for an individual, and it's going to be expanded to 133% of the poverty level. So that's a safety net to pick up the poorest of the poor and help them get health insurance. So we're going to get into these 5 items and drill into them in a lot more detail because these are big things that are coming and they have big impact on us, okay? So the first one, the individual mandate, comes into effect January 1. Every citizen of the United States of America, and that's your children included, are required to have health insurance. If you don't have health insurance, as I said, there's a tax or a penalty. Now this is where this adverse selection issue comes up. You put the guaranteed issue next to, as you can see up here, a $95 per person fine. Okay, so has anyone paid less than $95 for their health insurance anytime recently? Probably not, right? So you put the fine next to the premium, and there's very little incentive for a young person who considers themselves kind of indestructible or not needing this expense and this hassle in their life. There's really very little incentive for them to buy insurance when they can pay a $95 fine, and then because of guaranteed issue and no pre-existing conditions, if something actually does happen to them, they can come back and they can get right into the insurance pool with everybody. That's what we call adverse selection, okay? So I equate that to, if you could buy your homeowner's insurance once your house is on fire, would you ever pay your premium in advance of that, Probably not. So upstanding citizens like members of the Michigan dental community typically are going to have insurance, but it does create some possibility for abuse. And the trouble with that abuse is in the insured market, if we want to still have an insurance company behind our health plan, we're getting lumped in with all those groups, okay, by this community rating rule that we're going to talk about in a little bit. So the individual mandate doesn't have much teeth behind it right now. You can see that the penalty does increase over the years, and so it's maybe in a couple years down the line there'll be a little bit more teeth behind it, but right now there's very little penalty for not buying, and then one can get in without no questions asked in the future. Now, the advanced premium tax credits or subsidies, they're based on household income, and as I mentioned earlier, they're up to 400% of the poverty level. We're going to throw a slide up here in a second that shows you the actual numbers behind what that means. But the subsidies are basically a deduction from one's premium. So if someone was eligible for a subsidy, and in theory you would go on this exchange or marketplace and you get to see plans, and the plan might say it's priced at $500 a month, and the government might say, but you're eligible for a $300 subsidy. So your net cost is the difference, the $200. That's what the bill's going to be for someone who's eligible for a subsidy. So that's how it works. You don't get cash in your hand to pay premiums with. but you get a deduction in your premium schedule if you are eligible. In addition to having low income, which we're going to go over on the next slide, you also have to not be offered insurance by your employer that's deemed affordable. Affordable is defined as if the employee has to pay more than 9.5% of their pay to buy insurance, then that's not affordable. If they pay less than 9.5% of their own income, then it is affordable, okay? But remember, if you employ less than 50, you're not required to provide health insurance at all, nor does it have to be affordable, okay? I'm just pointing out for those who might be subsidy eligible that if your employer does offer you coverage and it's deemed affordable, you would not be able to shop at the marketplace, okay? And that's reconciled. So the IRS is in on this now. It's reconciled on your tax return every year. And you know, that's going to be fraught with some perils too, because they're going to be giving these subsidies out in advance. They're advanced premium tax credits, just as it says. So you're predicting your income when you go sign up, you know, in November or December for next year. If someone gets a big bonus or gets a new job or their spouse gets employed and bumps their income up all of a sudden, the government actually might be there with their hand out saying, you owe me money back. We gave you more subsidy than you were eligible for this year. I really don't, we're going to look at the numbers here next. I don't anticipate, you know, any dentists, unless you're retired, disabled, that kind of thing. Most dentists are not going to be eligible for subsidies. Probably a good majority of your staff might not be either, but some of your part-time staff, your staff maybe that's divorced with several children, that kind of thing, single parent, I should say, with several children, those folks might be eligible for subsidy. So we'll take a peek at that. So this is a grid to kind of give you an idea who might be subsidy eligible. So starting up in the upper left-hand corner, you know, that shows you what the current poverty level is for one person. It's $11,490. And it multiplies up for each family member you have. So that's why I mentioned if you were a single parent with a few kids, again, you may be eligible for a subsidy. So subsidies up to 200% of the poverty level are pretty substantial. And we'll show in the next slide, you know, how much of your premium you might expect to get if you're making, you know, less than $22,000 a year. After 200% and between 200 and 400, people are eligible for subsidies, but they start to decline pretty rapidly, where there's going to be quite a bit of out-of-pocket premium expense for people making $22,000 to $45,000. And as you see, if you happen to be that single parent, you know, with 2 or 3 kids, that number jumps up to $78,000 to $94,000, where you might still be eligible for a subsidy, and it's very possible you might be eligible for a substantial subsidy then. So here's what I was talking about. So this is a Congressional Budget Office estimate for a single person making about $20,000 a year. The estimate is that the government would pay about 3/4 of your premium. Someone making $32,000, it drops down to less than half. Then you start getting up to that, you know, closer to the 400% level, and you're looking at 10 to 15% of the premium. And there's probably 5 million people that will not be, of the uninsured, that it won't be eligible for any type of federal assistance at all. So one of the things too, now these exchanges, we're going to talk about them in a second. The exchanges aren't working right now, but we have been able to actually look at the products and the prices separate from that, not on their actual website, but just separate from that. And one of the big problems, even with these subsidized policies that we're seeing, is the co-pays and deductibles are through the roof on these things. So we'll talk about that and show you why that is when we talk about the metal tiers here in a little bit. So the exchange or the marketplace, all right? So in theory, that is a web page where individuals can go, who are eligible for a subsidy, can go shop for insurance. It's going to, you know, in theory, again, it's going to work like Travelocity or something like that, where you're going to go online and compare prices and plans and make an informed decision. Now, even before the websites went bust, which we could talk about in a second, you know, we had our doubts about this method of purchasing insurance. I think most of you would agree, and you look at that glossary of acronyms, you start talking about deductibles and co-pays and prescription drug codicils and generics versus brand and whatnot, that it can get very confusing. Buying a health insurance policy on premium alone would be a mistake. You got to look at the premium and the coverages and the deductibles and co-pays. It's not the same as going online and deciding, you know, Red Roof Inn versus the Hilton versus the Ritz, all right? We look at those three items and we all pretty much know, you know, the Red Roof Inn's going to be the least expensive, and we know what we're giving up when we decide to stay at the Red Roof Inn, and we know what we're getting when we decide we want to go to the Hilton or the Ritz. Well, it's not quite so easy to peek at a health insurance policy and know that. And because of that, you know, we've been confident throughout this process that people like us and our expertise are still going to be in very high demand. We're going to be here to help you sort through plans, whether they're on the market or off the market. We're still here for you. We understand insurance. We know deductibles and co-pays. We know what your exposure is going to be versus your premiums. We're going to have the best idea of what might work best in your situation versus you trying to muddle around on your own on a website and figure that all out. So having said that, if you think you're eligible for a subsidy, or if you think people in your office might be eligible for a subsidy, we are licensed and approved to help people on the exchange if it ever gets working. We're licensed and approved. We have 5 people, all the people you just saw that I introduced you to. They're all licensed and approved to help your staff if you think they might be eligible, or yourself if you think you might be eligible for a subsidy. We're able to help you. There's no extra cost whatsoever to using our services than if you go muddle along on the website on your own. So by all means, if you think you have staff, if you have a family, if you have a child that's still in college and you think they might be eligible for a subsidy, when these exchanges start working, send them our way. We're happy to help them sort through the plans and see what they might be eligible for. They can get our assistance. It won't cost them any bit more than what they're paying right now. Now, as I mentioned, if you're not subsidy eligible, there's probably very little reason to go on the exchange. You know, first and foremost, they're a mess right now. Nobody can get on them. We've tried to be logging on for 2 straight weeks, and you just keep getting error messages. The government says they're working on it, but quite frankly, if they don't get it fixed in the next 2 to 4 weeks, I think that they may have to do some serious consideration if they can really plow forward on this. So people have to have time to make informed decisions, and they're running out of time. So on the exchange, there's limited plan offerings. I mean, we're going to have access to all the plans through MDA Insurance. We'll have access to all the plans that are on the exchange and all the plans that are off the exchange. Plus, we're going to have our exclusive MDA plan that we're going to talk about a little bit. So again, there's really no reason to go shopping anywhere else. We're going to be a one-stop shop for you and your staff, whether you are subsidy eligible or whether you're not. Now, again, in theory, the first open enrollment was supposed to start October 1st. So to our knowledge, we're members of 2 associations ourselves, just like you're members of the Michigan Dental Association. Tina and Art and all myself are members of the Independent Insurance Association of Michigan and the National Association of Health Underwriters. And just like the 5 or 6 people in my office who got licensed to do this, there's literally tens of thousands of insurance agents all across the nation who have gone through the training and been approved to help people on the exchanges. And our 2 associations are reporting this is how many people, 20,000 agents licensed in the United States have signed up. 0, okay? Nobody can get through on these marketplaces or exchanges right now. We don't know of one person that has been signed up yet. So it's not working the way it was supposed to. We'll have to see. Right now, open enrollment is supposed to go from October 1st to March 31st. To get an effective date of January 1, you need to have applied by December 15th. So the clock is really ticking down for this individual mandate and people's ability to buy insurance. After this year, assuming they don't change the rules or whatnot, open enrollment is going to occur once every year from October 15th to December 7th. So that would be the opportunity for people to change their mind and switch plans, or for people to enter into a new plan at that time. So in Michigan, the way healthcare reform was originally passed, every state was required to set up one of these exchanges or marketplaces. Of course, many of the states balked at that because states are all broke, right? We're all looking for money to fund all of our projects, and suddenly the federal government's telling them they have to spend millions of dollars on technology and staffing these exchanges and whatnot. So interestingly enough, only about even many of the Democratic-led states do not have their own exchange. So only about 17 states went with the state-based exchange. The other 2/3 of the states, 35, 36 states, are on a federal facilitated exchange. So the federal government is running the exchange in Michigan, and that's the exchange or the website that is non-functional right now, okay? Now, the large employer mandate, most dental offices are 50 or less. I'll acknowledge that, but I do want to talk about this a little bit because number one, we do know that there's probably 10 or 12 entities in Michigan that are bigger than 50 dentists. And number two, there's some special nuances and rules that if you own other businesses, I want you to pay close attention to, okay? So number one, the government counts full-time employees a little differently than you might count full-time employees, okay? So the first thing that they did that's a little different is they defined full-time employees as 30 hours or more a week. So, you know, long as I've been in the workforce, full-time's been 40 hours or more a week, but for this purpose, it's been defined as 30 hours or more per week. And then, in addition to that, they also look at your part-time employees. So, 2 15-hour-a-week employees is 1 full-time equivalent employee, okay? So, they're going to add those together. And then this last bullet is kind of the last kicker. So we got to count people over 30. We got to aggregate the part-time people. And then this is the one that worries me a little bit because I know a lot of dentists who own, say, a restaurant or they own a couple Subways or something like that, okay? So it's all businesses under common ownership. So if you are one of those people, it's not just your dental practice, okay? It's your 2 Subways too. Then we got to add up all the employees as well, okay? If anybody thinks, when they start thinking about adding part-time employees up or adding in other businesses, if anybody thinks they're 50 or more, I would, or they're worried they might be, I encourage you to get with us afterwards. You're in a whole different situation than most dentists, because most dentists don't have to offer insurance to their employees. You might have to. You're looking at a lot heavier fines than some of these other ones. We need to start talking with you right now. Do the math, decide if you really are 50 more or not. And then if we decide you are more than 50, then we need to start talking about what we're going to do to avoid these taxes and penalties. Now the good news is the top bullet said this was supposed to take effect January 1st of 14. And like many things, this is one of the things that's been delayed, okay? So as we were out roasting some marshmallows at the Petoskey State Park, my family, the Obama administration snuck that one out on July 5th. They tend to like to publish their fine print and their rules late on Fridays when no one's paying attention. So if you missed that one or you were roasting marshmallows like me, the employer mandate got delayed by 1 year till January 1st, 2015. So here's a quick math problem showing you how to count employees, how to add your part-time people up. Again, in this scenario, this person's under 50, so they do not have to offer health insurance to their employees. Now, keep in mind, even though most dentists don't have to offer health insurance to their employees, many of you do and have for many years, even though you didn't have to. And you do that because you want to attract and retain good employees, and you want your employees to find your place of business a good place to work. So just because you don't have to doesn't mean you wouldn't want to for all the reasons that you have for a long, long time provided health insurance to your employees. So the penalties for large employers are a lot more significant than for those individuals. Remember, they got only a $95 fine. The large employer fine is $2,000 per head. less the first 30 people. So if you had 100 employees, get to subtract the first 30, 70 times 2, you got $140,000 tax or penalty to pay to the government. In addition to that way of equating it, it's either or, whatever works out highest. If for some reason you did offer insurance, but some of your people still leaked off to the exchange because it wasn't considered affordable or it didn't cover the essential benefits, then you get to pay $3,000 for each one of those persons who leaks off to the exchange as well. So whatever one of those two taxes is, the bigger one is the one an employer who doesn't meet the large employer mandate, that's what their tax is. Now, even though the mandate was delayed, we still have, for everybody, we still got that 90-day minimum wait period. And for large employers, if you have 250 or more W-2s, we do now have to report, those large employers have to report the cost of the health insurance that you're providing to your employees on a W-2. Right now, that is not a taxable, it's just informational. But you know, some of the cynics in the world worry that as soon as that information is included on everybody's W-2, how long until someone gets the idea that that would be nice to tax that as well, because we could use a few bucks for something. So we're lucky, I think, to be in the small employer market where we've dodged that for this point in time. Now this is one that snuck by a lot of people as well, all right? So this is all employers. This is whether you're 50 or more or 50 or less. This is whether you offer health insurance or whether you don't. You were supposed to, a couple weeks ago, have provided all of your employees a notice of this marketplace or exchange. So the federal government, as part of healthcare reform, required all employers to tell their employees about this marketplace or exchange. There's a template that you just fill in a couple blanks on our website, www.mdaprograms.com. I think you'll find the connection right on the home page to it. There's a different one if you're offering health insurance and if you're not. Even though it's past October 1st, you know, I think doing it late would be better than doing it not at all. But again, like many of the things with healthcare reform, the government added a little fine print, or actually good news to this one about 2-3 weeks ago. When it was passed and contemplated, there was a $100 a day fine for not doing this. The government did come out very recently within the last couple of weeks and say, okay, we're not going to penalize. We still want you to do this, but no fines or penalties if you don't, okay? So they did back off on that. It was a pretty onerous requirement, a pretty onerous fine at $100 a day per employee. So I thought that was pretty good news. If there is any in us. So Medicaid, we did approve the expansion in Michigan finally. The governor, it was kind of an interesting thing. The governor's, of course, a Republican governor. He was advocating for the expansion. Many of the Republicans in the legislature did not want to approve it. Again, it's a money thing. The federal government's going to pay for the expansion for the first 3 years, but then after 3 years, the state of Michigan has to pick up at least 10% of it, and there's concerns, of course, that it could be even more than that. And you know, again, where's the money going to come from was the debate, but ultimately the decision was made to go ahead and expand Medicaid, so up to 133% of the poverty level. The one caveat is it's not going to be effective until April 1st instead of January 1st. They didn't have enough votes to give it immediate effect, but they did have enough votes to pass it. So again, that's not going to have a big impact probably by practicing dentists, but if you have family members or disabilities or things like that in your family, then maybe that might be important to you.